My name is Kissin. I'm an orthopedic surgeon up at Hackensack University Medical Center, and I've been using Prineio for over 5 years on all of my total knees. So while in general most incisions are 20 centimeters or less and one mesh patch is plenty, in an obese patient or in a more complex surgery or a revision surgery, larger incisions sometimes are necessary, and a second mesh is necessary to then have a full closure over the incision that we've made. So when I use Prineio 42, it's for those larger incisions. What I normally do is I do recommend going from distal to proximal and that the overlap be on the proximal end. The proximal side of the incision has more subcutaneous fat in it and then has a tendency to stretch a little bit more than the distal end. So if I'm going to overlap, I'd like that to be on the proximal end. So after I applied the first mesh patch of 22 centimeters, I assess to see how much more I need to allow about a 1 to 5 centimeter overlap. I usually take 2 fingers and that's generally sufficient overlap, and apply it so that it covers more than 1 centimeter past the incision. So once I've applied the second piece of the mesh, so now I'm covered from 1 centimeter proximal to 1 centimeter distal with a little bit of overlap. Then we bring the applicator in and we apply some of the liquid in a sequential fashion. I usually go from proximal to distal at this point. I make sure to cover all of the mesh, and you can see that the mesh changes in its appearance, and you basically want to make sure that you cover from all edges and all corners as well as the center of the mesh. So one of the main advantages of using Prineio is that there is no wound care. In the world now that we live in of rapid recovery, as patients are now being ambulated in the recovery room a couple of hours after their surgery and sent home sometimes the same day or in 23 hours, for example, I think surgeons will want to know that their closure is holding up, and the feeling that the incision is sealed and liquid tight, that's a very good feeling for a surgeon to have a patient leave the hospital and go home that way. Patients are very happy that they're allowed to shower with no extra added dressings or anything like that on their knee, and they're very excited about that. I've been using Prineio as one of the early adapters, and I've continued to use it. I'm very confident just in the way that it has performed. I see no reason for change at this point because I think this is the best way that I can close a patient's knee, and patients seem to agree.